call the meeting to order of the Otero County Board of Commissioners. Any public comments? Seeing none. Presentations. Dr. J.C. Carrica.
Well, I don't have any awards to hand out, so Donna was right, the highlight is over. Thank you for granting me a few minutes to talk about the regional accountable entity map. Before I do that, I just want to hand out my new cards. I would have a new title. You can still get a hold of me the same way you always have. Same cell phone number, it's been around for 25 years.
Smoke signals.
That works. And then we also have a grand reopening coming up in Rocky Ford on the new clinic, the remodel that you saw on 12th Street. And so I'd like to welcome you all to that if you have time. Absolutely.
Yeah, it looks beautiful.
Thanks, they've done a really nice job.
Yeah. With all the times I've been there and done plumbing work, I can hardly wait to see it.
I bet that's true. So I come to you today to talk about the new map proposal for what we call ACC 3.0, or Accountable Care Collaborative, also known as the Regional Accountable Entities, or RAINs. We're getting ready to have our third edition of that model here coming up in July 1, 2025. And I believe you were privy to the map that was proposed by the state showing what we call an east-west version. And while we believe it captured the particulars of balance in the sense of 2 urban and 2 rural rays, because that's really part of what I believe the county commissioners at CCI wanted, was more representation and a stronger voice for rural and frontier counties. It creates that 2-2 balance, in theory. 2 rural, frontier rays, 2 metropolitan. But what it doesn't capture accurately, in my opinion, is the way that patients flow. If you look at the map they proposed, it has southeast Colorado connected to northeast and north central Colorado. Medicaid utilization does not support that that's where people travel for care. If you look at utilization costs and claims, people don't go north to find more access to care. I think we can all agree that whether you're a Medicaid eligible member or private insurance member, if we don't believe we can't receive the services we need in our backyard, we go west. We go to Pueblo or Colorado Springs. So hence why we, with many other stakeholders, work together to propose a north-south map to follow patient flows across the state rather than an east-west map. The other thing I think that's interesting about it is if you look at collaboratives outside of even the Medicare population, most of our colleagues that we work closely with regarding patient similarities, whether that be, I would imagine, DSS directors, or physical healthcare providers and behavioral health providers, we usually consult with people to our west. We often look similar to San Luis Valley. Our demographics look similar to San Luis Valley. Our economic conditions look like similar to San Luis Valley, much so than they would northeast or north central Colorado. So I believe we've established those partnerships for the last 25 years, at least in my industry, and I'd hate to see those partnerships end and have to be recreated as a result of a new design through a new map. If you look at the numbers, by switching the state from north to south to east to west, I think I indicated in that letter it had less than so the Medicaid member change would be within 10,000 people by switching the map. So in theory, you'd have 245,000 Medicaid members in southern Colorado, 355,000 Medicaid members in northern Colorado. And that's within 10,000 members of what they propose, so statistically it's insignificant change when it comes to membership. The reason they want to go from 7 regions to 4 is so that you're addressing more lives, which means when you take on behavioral health risk, you share that risk across more covered lives versus less. The current RAI, one of the current RAI model faults, in my opinion, is like the Northeast Corridor, they only have 80,000 covered lives. Well, when you start taking on risk payments on Medicaid eligibles and trying to manage their cost of care, you can't spread the risk very far across 80,000 versus a proposed map of 250,000 minimum. So the state, by going to 4 regions, makes sense because health insurance companies are gonna bid on those regions because they feel like they can manage the risk versus an 80,000 member region. So there's a lot of good in what they're intending to do, but again, my opinion and many of the others in Southern Colorado work in this industry believe that we look more similar north-south than we do east-west in almost everything we do. All traffic patterns, all fronting. And what we decide here in this map, I believe, is gonna lend itself to what the behavioral health administrative service organizations are gonna look like, the BAHASOs. So that's gonna be your block grant dollars. They're gonna flow to regional entities to dispense those dollars to go out and deploy strategies for healthcare. Well, again, if we look at what the opioid regions look like, the money funnels to Pueblo and then is dispensed to South Central, Southeast Colorado. This would put us in a Northeast Corridor, which doesn't even align with what the opioid distribution strategy and committees look like now. So if we stay north-south and the BAHASOs are created to look like the Ray regions, which they're saying they will look like them, again, it makes more sense to work with a Southern Corridor network of providers and people. So that's my spiel. It's a pretty complicated process. But the other thing to keep in mind in the past is when money is attributed to the Ray regions, it's based on where your claims history is. So if I'm a Medicaid member and my provider's in Pueblo, the allocation goes to where I get the most of my services. Well, it works now because we're all part of that region. But if the attribution doesn't change and they say we're still gonna follow the claims data, and I'm part of Northeast, but my claims are out of Pueblo, the money's gonna flow to a different Ray. It's not gonna come to this Ray because that patient isn't getting the majority of their physical healthcare services in our region. So you potentially could have money reallocated to a region outside of where their behavioral health support is because the attribution follows their physical healthcare claims. And then Ray, when I questioned him about, or HICPUF, when I questioned him about the logic, they said, we're still determining the logic for attribution in the next version. And I understand that, but that has a huge implication if you're talking $15 million that may be going into a different Ray, for example, that really needs to come to this region for behavioral support. So what I'm asking right now is, first, should you have any questions? Number 2 is, as you look at the proposal, if you're willing to support it, I believe Jody Kern out of Rio Grande Mineral Combined Director, she is gathering the names of those willing to support this proposed model, and we're going to do one submittal, so one letter with just all the supporting entities and persons for reconsideration of the map.
You want me to start this?
Get after it.
So the proposal of the map, right? I've seen the 2 proposals, the one with the one you've got here, which is the north-south one, and then the first one, which was the more east to west. My question is, what if they change it again? I mean, and that's just it. If for some reason we sign on support and then we show that, and then they go, okay, but we're going to change it again. I guess there's no guarantee that it's going to stay this way either, right?
No, not at all. This would be the 4th version we've seen, Danny, or probably the 4th version in the last 7 or 8 months. The sticking point is the RFP should be going out spring. So we're coming up on a time frame where at
Yeah.
some point they can't change it because these insurance companies need to know what regions and how many covered lives they're building.
Yeah.
So between, I would say, if they're even willing to consider changes, I think they're all gonna have to be proposed by September. We may see one more revision coming out, but we're running out of time for this to keep changing.
Yeah.
Yeah.
So, again, inevitably you're gonna make somebody not happy.
Oh, yeah,
Um,
that's what I do.
No, not you, I mean them. Them. I mean,
Well, that's
what they
do.
propose, not you, but what they propose, inevitably, they're gonna make somebody not
Yes.
happy. Like, you know, we weren't happy with the first
Yep.
version, and whatever version we looked at before.
There'll be a knee-jerk reaction.
Yeah, and why the emphasis on 4? I know they wanna go from 7 down to above 3, right? Why 4? Why can't it be 5 regions?
There's conversations about that.
Oh, is there? Okay.
There has been. It went from 7 to 3. Well, first we thought it was going to go 7 to 1. Then it went 7 to 3. Then there was conversation we needed a 4th. There is conversation still out there, but I don't see any initiatives being led to move it to 5. I wouldn't be opposed to a 5th, but I don't see anybody taking the lead to making any changes to what came out at this point.
Yeah, and I'm not
A
suggesting that.
knee-jerk reaction could be a 5th region.
Okay.
Absolutely, and that's what this has always been, push, present, react, and
Yeah.
that's where I'm at now.
Okay.
It's good questions, but it probably will change.
That's all I have. No more questions for me.
It makes more sense now that I've heard your explanation, the reason why. Donna, do you have anything, Donna?
Do you know, JC, what the conversations were with the Southwest and the Northeast with this change?
So, yes, so ironically, the largest FQ and behavioral health provider, federally qualified health center like Valley Way.
Thank you. FQ
Sorry.
is throwing me off there.
Yep. So the Valley-wide in the Southwest and the largest mental health center in the Southwest, they approached us probably 9 months ago and said, we look more like you all in the way we deliver care and our patient demographics than where we are now with the Northwest. So the Southwest would prefer to align with us, and I did receive information before coming today that 2 more federally qualified health centers in the Southwest are gonna sign on for this revision. Then the knee-jerk reaction would be that then the Ray up in the Northwest would be losing, I don't know, I'd have to look at my numbers to be exact, but let's say it's 80,000 members by moving the Southwest out of their service area. But as soon as they picked up Larimer County, they picked up 88,000. So that's where the switch is within 10,000 members. So we do have the Southwest FQs and mental health centers wanting to align with Southeast and South Central. I don't know where the commissioners land on that or the directors of social services. I just know where South Central lands, which is Jody's area. So, good question.
So then my next question then, you say it's based on traffic, whereas we send everything west. So does that side send everything to the east to Pueblo for treatments and stuff like that? Or do they go north to Mesa County?
I don't know that answer.
Okay.
All I know was that they said that in the way they deliver care and their philosophy around care and the demographics of people are more like us than Northwest.
Okay.
I can't imagine they would send a lot of people over Wolf Creek Pass for care.
Right.
But that's my assumption, right? And so I don't know.
Okay.
We have
I
been
don't need to
working-
know, I just
That's a great
thinking
question.
about traffic wise.
I can say that there's been a group called Southern Colorado Healthcare Network that I helped start my prior title 5 years ago, and at the time, it had every federally qualified health center and every mental health center from Kansas to Utah working together every month, except for Pueblo Community Health. That FQ didn't join. But 11 of us got together and met every month to try to work out healthcare kinks for the residents of our region. So there has been a system of people, executives, been working for 5 years from Kansas to Utah, for the most part, all south of Highway 50. So that's why I think the Southwest bunch are saying, yes, we want to come aboard because we've already working on these initiatives with you guys. So, and if you ever have questions, call my cell phone, chit chat with me. I'm certainly willing to answer whatever question. You may have, it's like Donna, some of this stuff you have to really do for decades to really understand why we
Yep.
came here today, right? How we get here. So this is one of my priorities that I'm working on now.
Okay. Thanks, Jason.
Yeah,
Thank you, sir.
Thank you.
Yeah, give us a
Yeah.
chance to look it over and we'll get
Well,
back
it's
with
easy to
you.
read too.
Yeah.
You want more fun stuff, you guys just reach out. Thanks.
I move to approve the consent agenda.
And I will second.
We moved and seconded that we approve the consent agenda. All in favor?
Aye.
Aye.
All opposed? Motion carries. Old business? None. New business? Liquor license renewals.
I guess that's me.
That's you.
Okay, there are 2 renewals being asked for, both Felicia's Mexican Food Restaurant and Lounge. And then we have Lahana Golf Course, better known as the Fairway. We have letters from the sheriff saying there have been no problems with any situations out there. Both have letters of good standing from the Secretary of State's office, and both have paid their necessary fees and are eligible for renewal.
Okay.
And there is also a request for the Danny Boy Foundation. I believe this is an annual festival. I believe this is the 4th year. They have a certificate of good standing from the Secretary of State's office. They will have security on the premises at the only gate into and out of the venue, as well as security inside. And all fees have been paid.
Can we do them all
I
together?
don't know why not, really.
I was thinking the same thing.
Yeah.
Yeah, I think you probably should do them separately.
Separate?
Yeah.
Okay, so I'll make a motion to approve the liquor license for the Lahana Golf Course, better known as the Fairway.
Second.
Okay, it's been moved and seconded that we approve the liquor license for the Lahana Golf Course, the Fairway. All in favor?
Aye.
Aye.
All opposed? Motion carries.
I move to approve Felicia's Mexican Restaurant liquor license.
I will second.
Been moved and seconded that we approve Felicia's Mexican Restaurant liquor license. All in favor?
Aye.
Aye.
All opposed? Motion carries.
And then I will move to approve the Danny Boy Foundation for theirs as well.
I'll second it.
Been moved and seconded that we approve the liquor license for the festival request for the Danny Boy Foundation. All in favor?
Aye.
Aye.
All opposed? Motion carries.
There's that one. And then this one is Felicia's, they have to go down to
Okay.
the east side.
Okay. Resolution 2023-10, authorizing revision of commissioner districts. Amy?
Well, since we're on resolution 10, does that mean summer's about over and fall's coming? Right?
Mhm.
Yeah.
Get here?
Yes.
All right, so what I'm presenting to you today, this resolution deals with the revision of commissioner districts. So per statute, the commissioners' districts need to be evaluated each time a census is completed. Looking at the census numbers and visiting with our assessor and our GIS mapper, it was determined that Otero County didn't have much of a change in our census numbers. In fact, it did decrease a little bit, that there's no reason to make adjustments to the districts at this time, so they will remain exactly the same. That's it in a nutshell.
Excellent. Over and done.
Yep. Okay.
Make a motion to approve resolution 2023-10, authorizing the revision of commissioner districts.
Second.
Been moved and seconded that we approve resolution 23-10. All in favor?
Aye.
Aye.
All opposed? Motion carries. Departmental reports.
Nothing here.
Okay,
Everything's moving along smoothly.
good. That's what we want to hear.
Yes, yes.
Amy.
Can't I say ditto? No. Lately, we've been working a lot, continuing with the detention development as well as the sheriff's administration building. Happy to say that the final design drawings were presented, late last weekend. So we're starting to look at those. I think one of them's 143 pages long of blueprints, so that's been fun. To pretend that we're architects, at least that's what I'm doing. So that's exciting, that we're taking one bite at a time and eating that elephant of building a detention center. I also was notified that a grant that we applied for to assist in funding that detention center was approved, and so we will be receiving $1 million from DOLA towards that project. And budget. Favorite time of the year, so things are going well.
Okay, thank you. Commissioners report. Jim?
Well, what Amy said, and I had a roundtable meeting last week. Other than that, same old.
Same old. Okay. Tim?
Yes, what Jim said. Amy, thank you for
Oh, yes.
for getting that for us.
Yes.
Good job.
Awesome job on the grant.
Yes. Like Jim, I attended meetings, not the round table. Not one of those nights. But regional healthcare, had a meeting on that. Attended the board. I'm glad you got that, Jim.
Yeah.
Board of Health meeting, working on. They were talking about opioid. Say that 3 times. Opioid stuff, and so it was interesting to find out about that. I attended TPR and CSED and Lamar talking about economic development and housing, houses that are available, being rented or completed. Conduit, had a meeting with Conduit folks about additional funding that they received to continue forward with bringing that water out here. And then, like Amy said, construction meetings. Yep.
Okay, with me, I had the same meetings that Tim was talking about, and getting really interesting with the jail meetings. We're starting to really see things coming along. It's really starting to take hold that this is really going to happen. It's pretty interesting. We've had a few CCI meetings to starting getting ready for all the legislative stuff getting started. So we're starting to have a few of those meetings, and then like with Tim, I've had a meeting with Secor in the last couple of weeks, and it's our Region 9 opioid abuse that we've gotten money from the federal government with the lawsuits, and it's been really interesting to see how much, so far anyway, we've gotten done. We're kind of leading the way so far. We're ahead of most everybody else in the state as to getting things done with this money, and so it's been interesting to watch it all come together. So that's all for me. So no more discussions. Any announcements?
No, sir.
No announcements. We are adjourned.